Hey, I'm Dr. Garcia. Just finished giving a talk here at Health Central Hospital on vitamins and hormones. Think of some good information, probably change your life, something you should tune into. Check it out. Okay. The first duties of the physician is to educate the masses to not take medicine. Wait. The doctor's supposed to tell the patients to not take medicine. Who said that? Who's this crackpot, right? William Osler. Turns out he's not a crackpot at all. If you Google him, the first thing you're going to see is that he's widely regarded as the father of modern medicine. As you continue to read, you're going to see that he founded the medical school at Johns Hopkins University, which is a very prestigious medical college. And as you go down further, it'll tell you that it's because of him. There's a residency program in the United States. Before him, can you guys hear me in the back okay?
Kind of.
Really? Okay. So before him, you went to medical school and then you just were a doctor, which should petrify everyone in this room, because medical students, I'm telling you because I was one, they don't know how to do anything. It was his idea to say, maybe these people need a little bit more time in the cocoon to mature a little bit more and be able to do what they have to do, right? So kind of a far-sighted idea. He also has some pretty cool pathologies named after him, Osler's nodes, right? So he was the person that realized that these patients that were coming into the hospital extremely sick and they had these painful bumps on their fingers, that those painful bumps represented bacteria that had flicked off from the heart valve, had gone downstream and had seated themselves in the fingers. So when he saw that, he knew this patient has infective endocarditis. That is, okay, I've been doing this for 10 years. I've seen that one time. So for him to have been able to understand what that was in the age before CT scans, in the age before sonograms, is remarkable, right? So I say all that to say, point is, this guy's a boss, right? He's a thought leader in medicine. But he died in 1919, before the obesity epidemic that we have, before the diabetes epidemic that we see, right? So if he were here today, I'm pretty sure the thrust of this comment was not to say, hey, doctors, take all your patients off their medications. He was trying to say, docs, you have to teach your patients how to live so they don't need so much medication, obviously, right? And so this is my medical license up here in the corner. The poetry behind that, I kind of stake my entire career off of this thought, okay? Now, this is my checkpoint clinic. This is 4 of 4, which implies that there's a 1 of 4, 2 of 4, and a 3 of 4. The second Saturday, so this is the 51st month in a row that I've done this. On the second Saturday of the month, you can mark it on your calendar for the rest of the year. We've already got the room reserved. I'm going to be here giving one of my talks at 8 o'clock in the morning, okay? The 8 o'clock thing, I know it's early, right? I've gotten a lot of hems and haws about it, but the reason it's at 8 o'clock is because I don't have any magic for you guys, right? I can't sprinkle you with dust and make you better, right? I need you guys to put forth a little bit of effort. So I say it's about the amount of effort that it took you to set your alarm clock, get up, get in your car, and get seated at Health Central Hospital by 8 o'clock in the morning. If you have that intestinal fortitude, then you can take advantage of what we're going to talk about here, right? And the reason I'm doing this is because people who know better do better. And I'd like to share with you guys, I went to medical school very late. I was 29 when I went to medical school. And I believed, much like you do, that the doctors are the good guys, right? They wear white coats, right? They have our best interests at heart. They're the smartest people in society and they look out for us, right? Now I've gone to medical school and now I'm on this side of the thing. And I can tell you that the medical community, there's a very cynical attitude towards you all. Behind closed doors, okay? So the doctor's lounge is right over there. I used to hang out there all the time. The tone of the medical professionals about you guys is almost like, these people can't be taught. They don't do what I tell them to do. If they would just do what I told them to do, they would be healthy by now, but they can't. They can never be taught. Get them away from me. I'm too busy as a doctor, right? Learning. But what I have found is the exact opposite is true. If you tell somebody something, you give them specific instructions and you explain to them, hey, if you do this, this is going to help you. People will bend over backwards to do what you're telling them to do. It's just the problem is that the advice isn't really there. They're not giving the advice. That's the main reason I do this. And the second reason for this particular talk is I'm running out of time. When I'm seeing you guys in my clinic, I'm trying to talk about, okay, so I got to field your chief complaint and then I have to try to kick you some information. And I'm getting to the point that there's so much stuff that I want to talk to you guys about that I can't get it out in time. So this is kind of a convenient way for me to be able to talk about some things that are off the beaten path. And particularly today, we're going to talk about hormones and vitamins. All right, so this little story starts in 2017 when I was finishing up my residency at Orlando Regional Medical Center. I was basically months away from being an attending physician, meaning I was going to be able to work on my own. And during residency, you basically learn how to, it's disappointing. When you're a doctor, you want to heal people, right? You kind of get into this because you want to heal folks. But when you go through the program, you realize that all you're really learning to do is kind of manage diabetes, you manage high blood pressure, you manage heart failure, you manage COPD, but you're never really, no one's showing you how to cure anything. No one's showing you how to reverse any disease at all. And so I had this daydream, this persistent daydream, which is funny, that I was going to be, so in Orlando, if anyone had any questions about how am I going to remove my medications, how am I going to get off medication, how am I going to get myself healthier, right? I wanted them to think about this face. I was going to be on billboards on the 408, and this is my fantasy, right? I was going to be, I'm a resident, I'm a third-year resident. I'm going to be on billboards on the I-4. I was going to be on commercials. I was going to be on benches. I was thinking about the bus stops. Everyone's going to know me, and they're going to know that if you want to get off medicines, you're going to think about this face and my organization, right? The funny part about that is, one, I had no idea how to do that, any of what I was dreaming about, right? And I didn't have an organization at all. I was just daydreaming, right? I'm sort of an amateur bodybuilder. So as all amateur bodybuilders are also amateur nutrition people. So I kind of just intuitively understood after 3 years of residency, I'm still kind of just playing this mental game. I'm a full-blown doctor at this point. I know people are going to want advice about nutrition, and I know that nutrition is going to be helpful and important to get them off their medications, right? So I'm going to be the face in Orlando. If you want advice on nutrition, you're going to think about this face and my organization. Again, like now as a doctor looking back, I didn't know anything about nutrition at that time. I thought I did, but I didn't know anything. And again, I didn't have an organization. Again, this is just a dream that I was having, right? And kind of the thing that was most meaningful to me was I wanted to be, so I used to call this checkpoint 40. This was intended for 40-year-olds because I felt like if I could reach you in your fourth decade and teach you a few important things, then I could keep all the diabetes, the high blood pressure, all the things that eventually end up causing us to be on medications. I could get you off of that, right? And I could help you plan for this, right? This is a happy, healthy 7th and 8th decade, right? But again, I had no idea how to do any of that. And I had no organization. It was just a dream, right? So as I started working and seeing patients and thinking about these things, it occurred to me, I thought, why is it so crazy that when I'm talking to a patient and I say, okay, we're going to try to get you off your blood pressure medication, or we're going to get you off your diabetes medicines, why are they so puzzled by that? That's like a foreign concept. You're a doctor and you're going to try to get me off medications, right? It's crazy that's crazy. That should be the norm. You get what I'm saying? Like, so think of what I just said. I mean, my whole daydream was I wanted to help people with questions about their medicines get off of them by using nutrition and plan for a healthy 8th decade. Shouldn't that be what we're doing? That's like what we should be doing, right? So why aren't we reaching that goal? Right, and so I'm about to spill the beans right now, and I don't think many of my medical colleagues would appreciate this, but I don't care because they're not my patients. Okay, this, and I brought it here for you. This is the Medical Knowledge Self-Assessment Practice book. Okay, every one of your doctors, your cardiologist, your endocrinologist, your pulmonologist, your oncologist, all of them. Right? They have to read these books, okay? Why? They have to read these books and memorize them to the best of their ability because then they got to take their board exam. They sit for this exam, it's 8 hours long, it's a big pain in the ass, and they regurgitate what they have memorized here onto this test. And once they do that, they have a license. And they have a license to make more money. You're not going to be rich when you're a doctor, but you don't got to worry about money. Like it's kind of like a comfortable thing, right? Just look at this, okay? Cardiovascular medicine, all of the heart. There's about 120 pages there. That's what your doctor knows. That's what he has to study to get this, okay? My favorite is, and we're going to talk about this in a minute, endocrinology. This is all of diabetes. This is all of hypothyroidism. It's about 75 pages, guys. That's what your doctor knows. That's what he has to know to pass his boards, to make a good deal of money. Now, let me ask you this. Let me tell you this. Your doctor, like I used to think, when I was in my late 20s, that doctors were like burning the candle and like reading all the time, and they would go home and they were just like learning, these machines of learning, right? It's not real. They see their 25 patients, they go home, they walk their dog, they crack a beer, and they sit down in front of the TV to watch the game just like you. That's what they want to do, right? The learning has stopped here. This is where the learning stops, okay? That's why it doesn't matter if you see a doctor in California, if you see a doctor in Miami, if you see a doctor in Ocala, Orlando, wherever. It's all the same. They're all doing the same thing. Right? You're all trying to put me on a statin, but none of you are asking why my cholesterol is high. You're all trying to put me on blood pressure medicine, but none of you are asking why my blood pressure is high. You're all trying to put me on metformin, but why is my sugar high? Right? Let me give you a quick example. This is disturbing. And I brought the books in case you guys think I'm lying. Diabetes affects 38.4 million Americans. It's a big deal. There's diabetics in this room right now, right? And if you either are diabetic or you know diabetics, right? And I can tell you from 9 years of practice, I love treating diabetes because we will reverse it. It will go away if you know what you're doing. And by the way, it all has to do with your lifestyle and the way you're living, all of it. Watch, you get that's here, you can check it out. 2 paragraphs on lifestyle when you read these books. So let's go to the endocrinology book. Here it is. About 70 pages for all of diabetes, all of thyroid, all of Addison's disease, all of the adrenal system. 70 pages. Nutrition therapy with a registered dietitian provides education to promote healthy diet choices. The ADA does not recommend a specific diet. However, and this is the funny part, evidence suggests that a decrease in carbohydrate intake results in improved glycemic control. Team, evidence doesn't suggest, that's the answer, that's everything, right? This is what we need to be talking to people about. So this is their big dietary paragraph, and then here is the big exercise paragraph. Physical activity recommendations include moderate to vigorous intensity aerobic activity for 150 minutes a week, vigorous intensity aerobic activity for 75 minutes a week, or a combination of both. Resistance training is recommended 2 or more times per week. Older adults with diabetes should engage in flexibility and balance training 2 to 3 times a week if possible. Prolonged sedentary behavior should be interrupted at 30-minute intervals with light activity and standing. Guys, that's what your doctor knows about treating diabetes. Then there's 7 pages on metformin, the GLP-1s, that's Ozempic, that's Mounjaro, right, the weight loss ones, SGLT2s, this is your Farxiga, this is your Jardiance, acarbose, secretagogues, this is Nataglinide, glipizide, all the medicines that you guys with diabetes are familiar with, DPPs, that's Januvia and insulin. 7 pages talking about that, 2 paragraphs talking about your food. Or exercise, right? So the answer to this question is right here. We aren't reaching this goal because doctors aren't being taught how to reverse disease. They're just not being taught. They don't know how to do it. That's the problem, okay? Now, so this is the 26 books that I read in 2023. Okay, there's a stack very similar to this for 2022. There's a stack very similar to this 2021 and 2020. I started doing this. I came up with this idea that I was going to read everything that there was to read. And I was going to be able to talk on any subject in 2019, okay? And what I'm telling you is that of all the books that I'm reading, there is a common denominator. There's a common thread. They're all talking about the same thing. I mean, to a degree. And I call these things the 5 healthy habits, okay? And we have talks about all of them. Those of you who come here, you're gonna know what we're talking about here, right? So the first thing, obviously, is food. If you believe that you have arrived at your current clinical picture without it being a function of your food, you're deluding yourself. It's the food, okay? So the first of 4 talks is gonna be about how you use your food to limit your insulin exposure, and by how limiting insulin exposure, you can keep diabetes out of the way, you can keep high blood pressure out of the way, you keep cholesterol out of the way, and you keep, did I say obesity? Obesity out of the way. Those are the 4 things that insulin affects, and that's all can be taken care of via your food. The second of 4 talks is about chronic inflammation. Chronic inflammation is the etiology of everything. PCOS, COPD, heart disease, diabetes, rheumatoid arthritis, all of it. It's like hundreds of things. If you can use your food to minimize your exposure to chronic inflammation, you can cure all of those things, or at least dramatically improve them. Sleep is another common denominator, team. All these books, look. Of all the years that you're going to spend on this planet, 1/3 of them will be sleeping. Your quality of life is in direct proportion to how much attention you pay to your sleep. It's not just this thing that you do, right? And you can do less of it or whatever. You need to pay attention to this. This is hormonal regulation. This is memory, dementia. This is huge, all right? Talk 2 of 4, we briefly touch on sleep, and today we'll briefly touch on sleep as well. Okay, but today what we're really here to talk about is hormones, and we're here to talk about supplements and alternatives, other things. Team, there is an avalanche of interesting things that are written about, facts, studies that have been done. It's known. But since it's not in these books, your doctor doesn't know how to talk about it. And exercise. So I've almost given up on my American patients trying to teach them how to exercise. I have one thing that I like to point out, okay? There's 5 zones of exercise. There's zone 1. This is when you're with your dog, right, meandering, and he's sniffing the bush and you're scrolling on your phone. That's zone 1. 0 points for zone 1. And then there's, right, so don't tell me, I get my 10,000 steps a day. I don't want to hear it. Unless you're sweating from your 10,000 steps, that's where you get money. And then there's zone 5, and that's, Usain Bolt coming down the final stretch, like at the Olympics, right? You need to be in zone 2. Zone 2 is where you could talk to the person that you're with, but you'd rather not because you're out of breath, right? That's where you get the most benefit from your mitochondria, autophagy, and all the benefits that exercise come into place. Okay, no talk on that. But I know that, so when I'm in clinic with you guys, mentally there's a mental checklist, and I'm trying to hit you with as many of these little bullet points because I know that the more of these I can get you to buy into, the better chance I have of making this person, right? And what is this? So this is, I believe, and I'm pretty good at this, I believe this is an 80-year-old lady, and I believe he's about 77, and they're messing around with cut-off sleeves at the park with the Superman cape, smiling, right, and living life. And they probably had sex later, right? That's what we need to be shooting for.
Very good.
Thank you. Thank you.
Absolutely.
Thank you.
What class was this again?
So, guys, when I talk about hormones in the laypersons, the layperson thinks, so hormones are everything. If you want to know, a human is basically, I jokingly say that you're a bundle of proteins under the direction of hormones. They are what dictate your blood pressure, they dictate your metabolism, they dictate your digestion, they dictate your sexual function. They dictate your thoughts, your feelings, right? Neurotransmitters, these are all hormones, right? What I'm talking about, I want to talk about sex hormones and particularly, and then I'm going to dabble briefly into growth hormone, okay? So ladies, you first, right? You first, ladies. Look. Changes of life. It's going to be so fun. It's a big adventure, right? Changes of life. Does everyone know what a euphemism is? Euphemism? Okay. A euphemism is a word that is used because it sounds softer and more pleasant than what the real word is, right? So like, for example, if you've been at your job and you've been downsized, well, you were fired, right? So that's a euphemism, right? So George Carlin does a really good skit on this. So there's the changes of life, and then there is menopause, right? There's menopause, right? And you better not talk about it, gentlemen. So, you're hot, you're irritable, you don't sleep, sex is no fun anymore, right? Why? What's going on? And what's going on is life is like this beautiful symphony, and it's all a hormonal symphony. So over here you have digestion, It's going well, you're in your 40s and digestion happens, and then over here you've got your blood pressure, it's perfect, and then over here you've got, metabolism, your thyroid, TSH, and everything, and over here you've got your sexual function, and it's great, right? And then, right around 50, 51 years old, your entire string quartet and all the brass in your symphony gets up, and they walk out. Of course you don't feel normal, right? You can't. Half the members of your symphony are gone, right? So let me tell you, prior to 2002, it was standard procedure in the United States when a woman went through menopause, she went to her doctor, she says, I'm not feeling good, vaginal dryness, I can't sleep, and I'm in a bad mood. Standard, they give you Premarin. Premarin was estrogen replacement, right? So then they did this study, it was called the Women's Health Initiative, the $1 billion study, 100,000 women, and they said that they were going to determine what was going on with the effects of Premarin on women, right? So they had to stop the study 2 years, after 2 years into it, they stopped the study. And they plaster on the headlines that Premarin causes breast cancer. And all of the women at that time came off of their hormone replacements, right? Now, that was the $1 billion study. They say it will never be repeated because of how expensive it was, right? But in the subsequent decades, that study has been, they picked it apart into its minutia. And what they found is of those 100,000 women that were in the study, a significant amount of them were diabetics, a significant amount of them were smokers, and a significant amount of them were obese. So it's impossible and it's wrong to attribute the increased risk of breast cancer, which, by the way, it was 1 in 1,000 women develop more breast cancer. This is what the study showed. And they attributed it to Premarin. But they didn't take into account the fact that these are 3 independent risk factors to have breast cancer anyway. So if you're diabetic and you're obese and you're a smoker, well, you have a higher risk of having breast cancer. You can't attribute it to that. People have come out subsequently and said, like researchers who worked on this study, they said, yeah, we messed that up pretty bad. We messed it up pretty bad. So this guy, Avram Blooming, he wrote this book here, Estrogen Matters, probably the most challenging book I read recently. It's difficult. But he followed and he really studied these women, right? So, okay, so you had a 1 in 1,000 perhaps increased risk of breast cancer, but probably not even that if you're not a smoker, obese, or diabetic, right? But what they found is you have a 40% increased risk of heart disease. So once they got off of the Premarin, they continued to follow these ladies. You have a 40% increased risk of heart disease, you have a 50% increased risk of dementia, and you have a 60% increased risk of osteoporosis. So to save the 1 in 1,000 maybe, you gave up the 40 and 50 and 60% respectively. They have subsequently called the Women's Health Initiative the biggest crime that was committed against women. And so the point is, you have to address your hormones if you're going to try to plan to get into your 8th decade without problems, right? So what are your options? I have a way that I like to do it. It's my favorite way, but there's other ways to do it. You don't have to, but you should pick one and you should just do it, right? So what I like is pellets. The bioidentical hormone. Oh, the other thing about the study is that Premarin it's called equine estrogen. It's not even human estrogen, right? It was similar enough to a human estrogen that it would activate the receptors and it would take your symptoms away, but it's not human estrogen. Now, what we use is bioidentical hormones, meaning you look under a microscope at what we use now and you look under the microscope at what your body produced when you were a menstruating female and there is no difference. You can't tell the difference, right? So that's another flaw with the Women's Health Initiative. They weren't even using bioidentical hormones. Okay, so options are, yes?
So no genetically modified the pellet, it's absolutely.
It's made, I'll have to find out exactly, but it's run through like a papaya. They run it through a fruit, and that's how they make it. I honestly, I don't know how they make it, but I know that the whole point of the whole thrust of this movement is that it is bioidentical. That's the point. So what you have is your brain is talking to your ovaries, ladies. Your brain it's called FSH, follicle stimulating hormone. Your brain's yelling down at your ovaries saying, get me some estrogen out here now. But your ovaries don't work anymore. So your estradiol levels are low, and so your FSH levels are high. It's screaming loud, right? What we do is we take that exact level for you, and we increase the estradiol levels, and we wait until the FSH level falls, and we meet an equilibrium, right? And that puts you at about where you were when you were in your 40s. It's very precise, and it's very tailored to you. That's the way I prefer to do it. You can also do, though, if you're, it's kind of expensive, so it's like $400. You can do oral tablets, which is where I give you the pregnenolone, right? Pregnenolone. This is like the mother, right? This is like the substrate of what your hormones are made of. Your body has the machinery to turn this into estradiol and progesterone, right? And then I can add on what's called DHEA, which is the precursor of testosterone, and that will go into testosterone. Now, this is not as precise. I'm relying on your body's enzymes and your body's machinery to be able to do that, but at least it gives you something. This will take away your hot flashes. This will help you sleep for sure. Then they have creams, and they got all kinds of other, sublingual ways that you can do it. But I recommend that you get one and stick to it because, again, remember, increased risk of dementia, increased risk of osteoporosis, and increased risk of heart disease. After you go through menopause, your risk as a female, so you guys can't kill a menstruating female with a truck because you're protected with estrogen. But as you guys go through your menopause, now your risk of heart disease matches that of a man in less than 5 years. You're on par, right? So this should be taken into consideration. Now, real quick, and I'm kind of running short on time, so I'll go quickly through this, but this was a big aha moment for me. I have a patient who's 96 years old. I take care of her, and I take care of her 62-year-old daughter. And I'm doing a knee injection in the room with this lady. She's 96, and she could probably whip half the ladies in here. She's like a tough little lady. And I'm doing it, and this girl walks into the room, uninvited. She kind of just opens the door and comes in. Young girl, probably 45, good-looking woman. And she says, "Oh, I'm her daughter. I'm Rosita's daughter." And I said, "Okay, well, welcome in. Come on, sit down." And I'm doing the procedure, and I'm thinking to myself, in my mind, I'm thinking, how does this 96-year-old woman have a 45-year-old daughter? Strange, right? I'm like, wow, Sarita was fertile. And so at the end of the thing, the young girl, she looks over my shoulder and she sees my pamphlets for BioT hormone replacement. And she goes, "Oh, you do BioT?" I said, "Yeah, you interested in that?" And so I handed her the pamphlet. She goes, "No, honey, I've been doing that for 15 years. I said, 50? I said, "How old are you?" She's 63. She was the older daughter. And that was like a moment where I, note to self, get my wife on bioidentical hormone replacement therapy ASAP. Stat. Okay. So, but ladies, it's not just you. What's this guy thinking about, right? What's he sitting there worried about? He's going through some things. He wants to know, why don't I have any energy anymore? What's wrong? Where's my pep? I used to have pep. Why am I always so tired? Why am I always so anxious, right? Nothing's wrong in my life, but I feel uneasy. Men get hot flashes too, right? Why am I starting to get red for no reason? That's kind of strange. Why do I feel so lazy, so weak, forgetful, right? But the burning question on his mind is, why can't I shake the sheets the way I used to when I was a younger man? I used to be good at this. The reason is hormones, all right? And this case comes into me 3 times a week, super common. And the lowest hanging fruit here is to look at their testosterone levels. And then a man will tell me, "But doc, my last doctor checked my testosterone levels. They were normal." We're gonna talk about that. So look, this is how it works. The way that they find out what's the normal range is they take everyone in a demographic. So they take, for example, all of the men in Ocoee, and they average out your levels. And depending on what lab you go to, this is what you will get. On the low end, 250. And on the high end, it's 1,100. So if the normal is between 250 and 1,100, team, what is normal? There is no normal, right? So you got to take the patient into the context of the patient. So if I got a 37-year-old guy who's tired and his erections aren't doing what they used to be and he has no pep, but he's normal, that's not normal for a 37-year-old. You want to be in an optimal range. And in the same vein, if I have a 75-year-old guy and he comes in and he's at 350, but he's having symptoms, well, I can guarantee you when he was 40, he was over here, right? So normal means nothing. This normal range, that's garbage. Another commonly, mentioned, they commonly say, well, Dr. Garcia, testosterone replacement is going to cause prostate cancer, right? Every doctor believes that. Dr. Shippen wrote this book here. Anyway, it's called the testosterone syndrome. It's here somewhere. And he asked a very pointed question. He said, if testosterone causes prostate cancer, why don't we all have prostate cancer when we're young guys? We should all have it then. I thought that made a lot of sense. And then Dr. Friedman came through and he said, no, it's not the testosterone that causes the prostate cancer. It's the metabolites of the testosterone. So as we age, gentlemen, we make more aromatase. Aromatase takes the testosterone that you have, turns it into estradiol. Estradiol at the level of the prostate can cause the changes that make prostate cancer. It also turns into something called dihydrotestosterone, DHT, which acts at the prostate and at male pattern baldness. So if you know that and you can just responsibly block those metabolites, then the only thing you're left with is a high teenage level of testosterone. And the research has been done. High levels of testosterone cause apoptosis in cancer cells. That means programmed cell death. High testosterone cures or treats prostate cancer. It also, in the same book, they know testosterone also helps with breast cancer and it also helps with Alzheimer's disease. It's not like... It's done. The work has been done. The research has been done. But your doctors don't know about this. Now, so testosterone will make him mean. I hear about that also. Guys, we're talking about supplementing yourself back into a physiologic range of when you were a testosterone producing man. We're not talking about supplementing you into, on stage for the, a bodybuilding competition, right? The whole roid rage thing, that's when you're at like levels of 2,000 milligrams a week. We're talking about 150 milligrams a week. This is apples to oranges. And the other thing is, think of the 7th and 8th decades of life. There's a book called Outlive by Peter Attia where he talks about, so what we're doing right now in medicine is it's called medicine 2.0. We don't do anything until there's a problem, right? He's saying, and I think this is I feel like Peter Attia wrote my book. We know what's going to happen in the 7th decade. The biggest problem in the 7th decade is falls and broken bones. So you have to invest in your 40s and 50s in your muscle, right? How are you going to do this? So this week I had a guy, good looking, 62-year-old guy. I thought he was in his 40s or 50s. He came in with all this back pain. Tons of back pain up here, back pain. They've done a bunch of scans on me, doc, there's nothing there, I don't know. So I start reading the scans and apparently someone didn't look at the scans because it said right there, the guy has a compression fracture of his spine, in the thoracic spine. So I was like, no, dude, you have a compression fracture of your spine. So the first thing a doctor has to think about is, why did that happen? Why is your bones breaking for no good reason, right? Malignancy is a common cause for that. So I asked him, have you had your colonoscopy? Have you had your endoscopy? Have you had your prostate checked? Yes. So then what else is left? His testosterone levels. I guarantee you he's going to come back with a testosterone level of 87. I checked it this last week. I mean, I'll give you follow-up the next time we give this talk. But these hormones are what keep your frame strong so that you fall in your 7th decade and you're not breaking a hip, because once you do that, it's like 50% mortality within 6 months. You're dying, right? Again, that's the probability. Now I kind of got to move a little bit quicker, so I'm going to just very quickly gloss over sermorelin. Sermorelin is a growth hormone releasing hormone. Growth hormone is the first hormone that goes away when you're in your 30s, right? It affects sleep, it affects muscle, heart, bone, the whole 9 yards. Sermorelin is a supplement that you can take to be able to increase growth hormone. It's a prescription thing. Talk to me later if that's something that interests you. And then PT141 made it onto this slide. This is a peptide hormone that you can use that increases libido and erectile function and libido in females. I don't think it's worth talking about that right now. All right, so very quickly, I'm going to buzz through orthomolecular medicine, okay? I just want to quickly tell you, so there's basically xenobiotics. Xenobiotics are the medicines that you get from the pharmacy. They're processed chemicals and they're sold to you by the pharmaceutical industry. And then there's this orthomolecular branch of medicine which says that probably 85 to 90% of what we're dealing with as a population could be dealt with vitamins and nutrition. It's super interesting, and no doctor gets any instructions on it at all. I learned about this probably about 8 months ago. Okay, so, and it's kind of a good story. Miss Gentilella, she came into my office and she said, "Doc, I want you to read this book." Okay, that's a thick one. So I started reading. It's by Abram Hoffer, okay? Abram Hoffer is, he's a psychiatrist, and he treated 5,000, so he noticed, So a deficiency of vitamin B3 is called pellagra. Pellagra is dementia, diarrhea, dermatitis, and death. And he noticed that the dementia associated with pellagra was very similar to the schizophrenia that he was treating. And he noticed that if you treated the dementia of pellagra, it would go away very quickly. So he started just giving his schizophrenia patients high doses of vitamin B3, and he was able to cure. Now, so if you go to a regular psychiatrist and you have schizophrenia, they're probably going to cure you in 25% of cases with the medications that they have. He had a 90% cure rate. He was taking people, he was giving them high doses, so gram level doses of niacin, and they were getting better, like completely better. So he teams up with this other doctor who's studying vitamin B3 in depression, anxiety, and ADHD. Guys, 30 to 40% of my patients are on medications for anxiety, depression. It's super common. They were having 80% success rates treating these things with high gram level doses of vitamin B3. Addiction, so the Alcoholics Anonymous program, the guy that wrote the Alcoholics Anonymous book, and I don't remember his name right now, I think it's John Smith, he has some real generic name. They learned that by supplementing with gram levels of vitamin B3, it would take the cravings for alcohol away. Now, this is like my favorite piece here is the cholesterol piece, right? Because all of you have seen doctors and they've all told you that you need to be on a statin medication, right? Here. This is called A Statin-Free Life. This is by Asim Malhotra. This is the top cardiologist in the United Kingdom. I'm just telling you what he says in the book. The best study that they have on statins will give you a 4% risk reduction for heart attack and stroke. If you take it every day for 5 years, you get a 4% risk reduction. That's garbage. 20% of the people that take it are going to get side effects. Dementia is, if you look, I could pull up my phone. Common side effects of statins is cognitive impairment. I'm not making this up. This is known. Joint pains, myalgias, rhabdomyolysis, that's kidney problems. So where's I going with that? Oh, so for niacin, gram level doses of niacin gives you a 15% all-cause risk reduction. 15% versus 4%, right? Why don't you know that? It's because they can't patent this stuff. This is a vitamin, right? No, there is no incentive to let people know that this is real. They did tons of studies on mobility, arthritis, joint stiffness, and things like that. If you mix vitamin B3 with vitamin C, you can improve your mobility. It was the study showed like a 30% improvement in your mobility and a significant decline in pain. Now, I will be remiss if I let you guys hear this and don't warn you about the niacin flush, okay? So if you decide, niacin's for me, I want to get my cholesterol down, be ready, okay? Because there's something called the niacin flush and you are going to feel it. It feels like, you know, like you just got thrown in boiling water, right? It's hot and it's going to get your attention. And so the way you can mitigate that is by just starting at very low doses and slowly titrating yourself up. What else was I going to say about that? Oh, and so there's two different types. There's actually 3 different types, but I won't talk about one. There's niacin, plain niacin, and there's something called niacinamide, right? Plain niacin makes you burn. You need to burn to affect your cholesterol. If you're not burning, you're not doing anything for your cholesterol. All of the other benefits you see here, CKD, ADHD, addiction, depression, you can use the non-burn niacin formulation called niacinamide. All right, so then after I read this guy in his book, he's talking about Linus Pauling. Anyone heard of Linus Pauling? Everyone should have heard of Linus Pauling. He's the coolest guy. He is the only human on the face of the earth that's won 2 Nobel Prizes, okay? Unshared Nobel Prizes. He won 1 in chemistry and one in peace. I tell you this to tell you that he is a very serious scientist. He is like the foremost scientist of the 20th century, right? And he spent the last 30 years of his career dedicated to vitamin C. And I'm just gonna quickly show you something. All right, so real quick, and I'm running out of time. So let's say these are a bunch of cells, right? Let's call this pancreas tissue. Let's call it gut tissue. Doesn't matter. This is a bunch of cells and this is creating tissue, right? Now, what's cancer? Cancer is uncontrolled division of one of these cells. Growth goes out of whack. This cell starts dividing too much. Now it's dividing a lot more than it should be, right? And so now you have what's called a tumor. Now, tumors secrete something called hyaluronidase. Hyaluronidase is what breaks down this cement that's holding cells together. It's called your It's called your ground substance. It breaks down the ground substance and it allows these malignant cells to travel. And this is how cancer becomes metastatic, okay? And it happens all through here, right? So you get all this kind of traveling of these misbehaving cells. You follow me? Look how it looks like a crab, right? Cancer means crab in Greek. And so guess what vitamin C does? Vitamin C inhibits hyaluronidase and it strengthens the ground substance that hold these things together, because that's all collagen. Every step in collagen production is governed by vitamin C. So do you want a little bit of that? Or do you want a lot of that, right? So so people say, well, I take vitamin C, it's in my multi. No. This is to avoid scurvy. This is to avoid the pirate disease, right? But if you want to get these kinds of benefits, we're talking about gram level. So I'm trying to sell to my patients 2,000 milligrams twice a day. That's still low. All right, so let me talk one more thing that's kind of interesting. This is my favorite part of this whole thing, by the way. Colles fluid. Okay, there was this surgeon. He was an orthopedic surgeon back in 1897. And he noticed that a lot of the patients that he was taking care of, by the way, should I wrap this up? Am I talking too much? Is it okay? Okay. I didn't know how long this was going to go. Colles fluid, he noticed that a lot of the patients that he was taking care of that had cancer, when they would develop a strep throat or an erysipelas, which is a streptococcal infection, their cancer would go into spontaneous remission on its own. And he thought, wow, that's interesting. So he went ahead and he developed this thing called Colles fluid, which is basically just streptococcus. He gave people streptococcus. He gave 897 patients with cancer streptococcus. Of the 897 that he gave strep, over 400 of them went into spontaneous remission. And of those 400, over 200 were considered inoperable and advanced. So the question is, what happened? Why did that happen? And the consensus has been that it was a stimulus to the immune system. The immune system was challenged, it was stimulated, macrophages, neutrophils, lymphocytes, they attacked. And guys, our immune system is responsible for taking care of rogue cells that don't belong. If you find something like this when it's in its early stages, it's your immune system's job to take care of this, right? That's what autophagy is about. So it was the immune system that was stimulated, right? So what else stimulates the immune system like that? Vitamin C. Vitamin C has an appreciable and a dramatic effect on macrophages, neutrophils, and lymphocytes. And these are the cells that can go out and get these cancer cells and take care of them. They have done this. They took patients that had terminal, advanced, inoperable cancer, right? So after they've been done trying to do all the chemotherapy and the radiation, nothing's gonna work, sorry, you guys are gonna die. They gave half of those people, this is in a hospital in Scotland, half of those people got pain medication, time to die, and the other half got 10 grams of vitamin C. The group that got the 10 grams of vitamin C lived 400 days longer. So I don't know about you, but I'm not going to wait until I have an advanced inoperable cancer before I start supplementing with this thing, right? That's my point. Also, a couple of other interesting things, antioxidant. We use that word, but what does that word mean? Quick example, if you cut an apple, right, and you look at it, what's going to happen to that cut surface? It's going to turn brown, right? If you take the other half of that surface and you rub a lemon on it, the ascorbic acid that's on it is going to allow that side of the apple to stay fresh for several times longer, like 5 times longer. Now, why does that matter? Because every time you eat something, you're extracting energy from that food via oxidative phosphorylation. It's oxidation, that's what you're doing. So, do you want to rust? Do you want to get old, or do you want to not? Right, that's kind of what, so another interesting thing, antiviral, right? This is very telling. Linus Pauling wrote this book, Vitamin C and the Common Cold. They've studied it, this has been done. They measured kids that were in college. They gave a group of kids X amount of vitamin C, I think it was 2 grams a day for X amount of time, and then they followed the group, they didn't give and they gave. And who missed more school? It was 76% more missed days in the other group. It was a significant finding. So Linus Pauling took his findings to the Journal of American Medical Association and said, I want to print these. They said, no, Dr. Pauling. Why? Because 70% of our advertisers for this magazine are cold and flu companies, and they're not going to be happy, right? That's what we're dealing with, okay? Antibacterial, right? Collagen, what we were talking about the ground substance. Collagen is in your coronary arteries are all made of collagen. Your brain arteries are all made of collagen, right? They've argued that if you have healthy arteries, then the cholesterol plaques don't need to begin to form. And this could be a dramatic decrease in heart disease if you just had adequate amounts of C. So I'm gonna move along in the interest of time. Vitamin D. Got it. We're gonna, let me just knock this out and then please, I wanna take all your questions, ma'am. Yeah, we're gonna talk. So I'll make it like this, real simple. Vitamin D is super important in everything. Between 40 and 80% of Latinos and blacks are deficient in vitamin D because dark-skinned people came from near the equator, right? And near the equator, you're getting a ton of sun. And so you need to be able to, so all your skin pigment is just melanin that's protecting your DNA. So it doesn't allow damage to happen to your DNA, right? But when those dark-skinned people move to northern latitudes, United States, for example, now they're not getting that equatorial sun. And so now they don't have what they need to be able to convert the inactive form of vitamin D to the active form of vitamin D. So what do you get when you have vitamin D deficiency? Well, you get osteoporosis because your body doesn't handle calcium correctly. You get high blood pressure. You get more aggressive forms of cancer. And you get diabetes. Does that sound like a problem that's affecting the Black and Spanish community? This is super common. This is what they're dealing with, right? So move along. You all need more D. Okay. Go back. Oh, thank you. Okay, so really quickly here, we're going to talk about, vitamin C is a water-soluble antioxidant. Vitamin E is a fat-soluble antioxidant, right? There's this group of guys called the Shoot brothers, cardiologists out of Canada. They saw 50,000 patients. And basically, they experimented with vitamin E, alpha-tocopherol. D-alpha-tocopherol is the one that you need. It reduced the amount of oxygen that was needed by the heart. So what's a heart attack? That's when your heart muscle doesn't have enough oxygen. It reduces the amount of oxygen your heart needs. It reduces peripheral resistance, that lowers blood pressure. While they were treating these patients that had heart disease, they inadvertently treated tons of varicose veins because it has a favorable effect on the tonicity of your vasculature. So vitamin E, super useful and very little known about. The most common complaint I get is, Doc, I'm not sleeping, right? So after we've addressed hormones, right, because that's a very common reason to not be sleeping, supplementation with magnesium, right? And then they say to me, Doc, well, I supplement with magnesium. I do that all the time. The question is, what kind of magnesium do you use? Do you use oxide? Do you use citrate, which is what you get at Publix? Well, you're doing nothing. You're just pooping with that. That doesn't even make it out of your GI tract, right? You need glycinate. Threonate is glycinate and threonate. So glycinate is the one that crosses the blood-brain barrier, can affect your mood, help you with sleep, and threonate is the one that can help with your blood pressure. I have everyone that I'm trying to help get off blood pressure medicines on magnesium. And then quickly, methylated B complex. Here's what I'm going to tell you guys about this, okay? Have you guys heard, when you guys are eating something, you look on the bottle, on the bag, fortified, enriched? You know what that means? That means they spray it with folic acid, okay? That's what that means. Folic acid doesn't exist on the face of the earth naturally, okay? When you eat folic acid, your body has to convert it into the usable form of folate, methylfolate, right? So the way it does that is it takes these methyl factors and it is having to metabolize folic acid and make it into a usable folate. Now, why does that matter? Do you know how they're saying all the kids today have ADHD? They're all wacky, right? It's because they're eating all this food that's sprayed with folate, right? So their body has to take those resources, their methyl resources, to metabolize all this folic acid. And what that leaves on the table is, so has anyone ever heard of adrenaline, norepinephrine, serotonin? These are your neurotransmitters, right? So if a lion walked in here right now, all of our neurotransmitters would go through the roof. We'd be trying to feed each other the lion, trying to escape, right? But once the danger was fixed, our body has a mechanism to be able to metabolize those catecholamines. So we're talking about the norepinephrine, the epinephrine, and be able to bring us into a normal state. They involve methyl factors. But if you've been using all of your methyl factors to metabolize folic acid, then you have catecholamines that are hanging around, and they can leave people in like a heightened sense of anxiety, a heightened sense of, and this is why we're looking at all these kids that are acting weird. This is what the thought is anyway. So methylated B vitamins, that's the raw material that you need to be able to metabolize these catecholamines that keep you awake at night, that keep your mind racing. It's the anxiety and what's going on, right? So I think this is the longest talk I've ever given. I'm going to try to wrap it up here. The point of all this, family, is people who know better do better. And I challenge you to not trust Google. And the one thing I've learned about this is, as I've gone through and read these, we're talking about prestigious doctors and scientists and people that took time to write volumes, right? But if you go on Google and you Google niacin, it's dangerous. Don't do it. If you go on Google and you look up Linus Pauling, he's a quack. This guy won 2 Nobel Prizes. How can you say that, right? And I think it's because it presents a real challenge to the establishment. So this is my Instagram. If you guys, when I read stuff or if I come across something interesting, I throw it up on Instagram. I'll be here the second Saturday of every month. Next month, we'll go back to Talk 104, and it'll just continue that way.
We have about 5 questions.
Okay. Ma'am, I didn't get to answer you.
Did you say that 2,000 milligrams is a low dosage for vitamin C?
2,000 milligrams twice a day. That's what I'm trying to get people to do, to get at least that. And the thing about vitamin C, so everyone's a little bit different, right? You'll know that you've taken too much vitamin C. How, ma'am? How are you going to know if you've taken too much vitamin C? You're going to have diarrhea. And that's the worst thing that can happen to you, right? If you notice that you're getting diarrhea, just throttle it back a little bit.
What type of seed?
Okay, so ascorbic acid or sodium ascorbate. I use ascorbic acid, and if you would like, so that you don't have to be choking down these pills because they're all big and chalky, you can get it in. I get it in crystal form. So you can take 2. This is the kicker here. It's 1/4 of a teaspoon. That's 1,000 milligrams. 1/4 is 1,000. I have my patient here. If you don't, can I joke? Okay. She was taking a tablespoon. Boom, tablespoon. So that was like 7,000 milligrams, and she was doing, several times a day.
How much did Linus take?
So Linus Pauling was taking, I want to say something like 14,000 or 15,000 milligrams a day. And the fun part about Linus Pauling is that he died at 97, still writing books.
Yeah.
Yes, ma'am.
What does that mean that vitamin C can be swallowed in water?
Yes. That's how I do it. I take the crystals, throw it in the water, and you just drink that down. Yes, sir.
Magnesium, can you take both magnesium taurate and magnesium glycinate? Like take taurate in the morning, glycinate in the evening?
I wouldn't do that. That's going to give you more than what you need. I would stick with the if you need it for like anxiety, then you want the one that's going to cross the blood-brain barrier, because it'll also have the other effects as well. You get me?
But the taurate's for the high blood pressure, right?
Yes. Well, magnesium's for high blood pressure. Period. Yeah.
Can you repeat what he was asking?
Yeah, so he was asking if you have an anxiety issue and you also have a blood pressure issue, should you be taking magnesium glycinate and magnesium taurate? And my answer to that, and I haven't read this anywhere, but the magnesium glycinate that's going to cross the blood-brain barrier and affect your mood should also be able to be in your system to affect your blood pressure. It should serve double duty. You don't have to take one for the other.
Oh, so you're reckoning glycinate over taurate?
If you're dealing with blood pressure as well, yes. Excuse me, if you're dealing with anxiety as well. Sleep anxiety. We'll talk about it.
All right.
Thank you once again, doctor. We appreciate it.